Today we have 82 new COVID-19 cases identified, including one which is epidemiologically linked, giving us a total of 9,220 people diagnosed with COVID-19 in British Columbia. That includes 3,360 people in the Vancouver Coastal Health Region, 4,712 people in the Fraser Health Region, 209 people in the Vancouver Island Health Region, 535 people in the Interior Health Region, 317 people in Northern Health, and 87 people who generally reside outside of Canada. We are now up to 1,261 active cases in the province in all health authorities, of whom 69 are in hospital, 19 of whom are in critical care or ICU. And that includes 29 people who are in hospital in the Vancouver Coastal Region, 36 in Fraser Health, 2 in the Interior and 2 in Northern Health. We have sadly one more death to report in the Fraser Health Region, bringing our total number of people who've died from COVID-19 to 235. And our condolences and our thoughts go to this person's family and their care team. And their community, who I know are mourning their loss. We have 3,093 people right now under active public health monitoring and 7,695 people who have recovered from COVID-19. I did want to note that we did a record number of tests yesterday, over 10,899 to be exact, for the 82 positive ones that were determined. And I think that's just an incredible feat as our lab has been ramping up, our laboratories have been ramping up across the province. And I know there's been some challenges in some places, but this really speaks to the amazing work that people are doing across the province to make sure that we can get people the testing they need as quickly as possible. We have one additional healthcare outbreak at the George Derby Centre, long-term care home in the Fraser Health Region, and unfortunately this is a recurrence, a second outbreak in this facility. It was a single healthcare worker, so we're hopeful, and Fraser is on site working with the team to manage this outbreak. We have 18 active outbreaks now in the healthcare system, 15 in long-term care and 3 in acute care units. And 860 people in the long-term care have been affected, including 513 residents and 347 staff. We have no new community outbreaks to report today, although we continue to have exposure events which are posted on Health Authority and the BC-CDC websites. And as we know, school exposure events are being posted as well on all Health Authority and BC-CDC websites, and people are encouraged to look at those as well. I would like to start off today talking about schools. I know that there is a lot of concern and anxiety still around schools, and I know this is because we all want everybody in our school settings, particularly our children, the educators, and all staff in our schools to be safe. And we have, as you know, developed COVID safety plans for each school. Each school has a COVID plan and is liaising with their public health school health officer all across the province. Like other aspects of our COVID BC response, we are doing our best and adjusting as we learn. And I think it's important to recognize that we don't always get it right off. And when we started sharing information about school exposures, our communications across the province were not fully aligned, and what was being said in one place was not always the same as what we're doing or what was said in other places. And we are working through those kinks and continue to refine our approach. And I am confident now that our communication approach is aligned in all health authorities across the province. I know this has created some concern, and I just want to say that from the very beginning it has been clear, and the most important thing that we have focused on in public health is that our public health teams have been there and done contact tracing and response for every single a case that has been identified in any school when there's been an exposure, and in any person in the province who has been identified as having COVID-19. Sometimes there are teachers or school-age children who have been identified who've not been in the school during their infectious period. And so those are not exposure events that we would notify in terms of the school. But I have been closely monitoring the contact tracing work that our public health teams are doing. And I am confident it is working and working well. And we know that because we are able to manage and determine every single exposure event, whether there has been transmission in the school setting, who has been close contacts, and making sure that those people have been isolated so that we break those chains of transmission. They're not able, if they get sick, to pass it on to others. Our public health teams are on the ground identifying every new case and following the processes that we have to notify and alert the school community of every potential exposure. And I want to provide a little bit more information on school exposures and clusters and outbreak and what we do with these. This is in keeping with what we do for other communicable disease events that we see in school and have historically. And of course, we've modified our outbreaks, our protocols, the exposure events, so that we can adjust to this pandemic. So a school exposure is when a single person is confirmed positive for COVID-19, has been in the school during their infectious period. So that's a common definition that all of us are using around the province. Many of the health authorities are also determining when a cluster, if that would be 2 or more people who are confirmed positive, attended school. But every time there is a school exposure, public health contact tracing kicks into gear. There are things that contact tracers do that are a skilled set that we have developed and we're very good at. We've done it for years, and we now have developed the skills that we know to understand what type of contact puts somebody at risk of being exposed to this virus, COVID-19. So we identify who is a close contact and who isn't. So even if you have been in a school setting with somebody, you may not be a close contact. You may not be at risk of exposure yourself. Anybody who did have contact where the virus could have been transmitted has been contacted by public health. And we know that's working, and we've seen it in schools across the province. And the role that we play, we know that if somebody has been exposed to this virus, there's nothing we can do to prevent them from getting sick if they've been unfortunate enough to be exposed to a large enough dose of the virus. So what we need to do is keep them out of the school, out of contact with others during that incubation period, which can be up to 14 days from their last contact, and making sure that they have what they need to stay away from others in case they develop symptoms. If they develop symptoms, then we can be sure that they're not going to be transmitting it to others. So if people don't have close contact, what we ask them to do is to monitor. And it's the things that we have in place in our schools, all schools, to make sure that people are monitoring carefully, that we stay away if we're sick, and that we keep those distances when it's appropriate, wearing masks when it's appropriate. An outbreak in a school setting is when we have ongoing transmission and we're not clear who has been transmitting to who. And there's widespread transmission in a school or in between groups of classes or learning groups. We have not had any outbreaks in our schools yet. In British Columbia, it is a possibility. We have seen it happen in other places, and we will be watching for that. But we do know our system is working because we are finding cases, we are finding smaller transmission events, and we're isolating people and preventing outbreaks from happening. Our contact tracers investigate when the person where the person who was infectious, whether it's a child, a teacher, a bus driver, our custodial staff are doing amazing work around the province, where they went, who they spent time with, what barriers were in place, the types of activities they did, whether they were wearing masks. All of those things are really important for helping us determine whether somebody had the potential to transmit this virus to somebody else. It's a highly skilled job that requires specific expertise, and our public health teams are really good at it. And they will sometimes talk to the teacher, they'll talk to other people in the school to try and understand better the circumstances around exposures. And as we've said, only close contacts or people who are at risk will be notified by public health. So let me provide an example. And these are types of situations that we are seeing happen now. A parent contracts the virus and passes it on to a child without realizing it. And we know that many people can have mild symptoms. And so before the parent recognizes that they're ill, they may have passed it on inadvertently to their child, who may also have very mild symptoms or no symptoms at all. And the child has no clear indicators of illness, goes to school. Perhaps he also hangs out with some friends after school or goes to another group setting, whether it's after school care or whether it's playing on a sports team or hanging out with a group while they're infectious. Then the child develops symptoms, or the parent gets tested and the child is recognized as being at risk and it gets tested, and public health is alerted when we have that test. Contact tracing then determines who is the people that they hung out with, who are the other family members that are at risk, who is the people who the person spent time with outside of the school setting, and what happened in the school setting. And from there, people are notified and are required to self-isolate. So there is many situations where students may have had contact outside of a school setting and may be required to be isolated and may develop symptoms and have COVID themselves. But the important thing is that we're managing the school environment to prevent transmission and ongoing movement of the virus within the school. And that is the chain of transmission. That's what we do to stop every day. And we do that by making sure people who are at risk are away from others during that incubation period. It's also why it's so important to use the layers of protection and really pay attention to how you and your family are feeling and stay home if you're feeling sick. It's also why it's so important to reduce those contacts outside of the school setting, where you might have other groups coming together and you might be exposed to risk. So our understanding of COVID-19 has grown. What we're able to do safely here in BC is also grown. It's much larger than it was in March and April. By staying small and staying safe, we've been able to expand those activities that we can do in our community that are important for our entire community wellness. Today, many businesses are fully operating, children are in school, as we've talked about, stores are open, but they all have COVID safety plans, and those plans are what protect people and what protect all of us. So we all need to continue to do our bit to make sure that we are keeping our distances, that we're wearing masks when that's not possible. And if somebody tests positive, public health will work to make sure that we remove anybody who's at risk from those situations where they can pass it on to others. The other important things, of course, are washing our hands, maintaining our safe physical distance, using a mask when needed, and always staying home when we're ill. Those are things that across our community will allow us to continue to have our schools functioning, to continue to have our businesses growing, to continue to have our small, safe social gatherings. That safe circle is what it is now because of everything that people in BC have been doing. And we've been doing our part to keep our community safe, and we want to keep it that way. But we have to keep working on it. We are on the right track, and I know we all want to keep going. We're learning to live with this virus, to minimize its impact on our communities so that we can do all those other important things as well. It's important we continue to keep our groups small, particularly our social groups right now. Stick to our safe six, minimize travel, and keep our safety basics top of mind. By supporting each other to do the right thing and offering kindness to each other, supporting each other to care for our friends, our neighbors, that's how we protect our communities, and that's what we have been doing and doing successfully here in BC. We need to continue to do this and to continue to care for each other and support each other and be kind and be calm, and that's how we will keep each other safe.